We're very interested in understanding how patients who receive CAR T-cell therapy, specifically ide-cel, BB2121, BCMA-targeted CAR T-cell therapy, can be selected in advance to understand if they are going to do better or worse. And so we use the KarMMa data to look at this to try to outline baseline correlative values of clinical characteristics and drug product characteristics that might correlate with achieving a CR. Now, the KarMMa study was a phase 2 pivotal single-arm trial of patients receiving BB2121, also known as ide-cel, BCMA-directed CAR T therapy for relapsed refractory multiple myeloma. And in that study, about a third of the patients did achieve CR. And those people who did achieve a CR had a very nice median PFS of around 20 months. So we're really trying to understand if we can figure out which patients are more likely to achieve a CR. So when we look at baseline characteristics, this is at the start of LD chemotherapy, we can see that there are some things in a multivariate analysis that come out. Presence of IgG heavy chain disease, elevation of serum BCMA, elevation of INR or PT, those were all negatively associated with the likelihood of achieving CR or stringent CR, whereas the vector copy number in the drug product was positively associated, meaning higher vector copy number in the drug product was positively associated with achieving a CR. We looked at an XG boost model of this, and similarly, you can see that IgG heavy chain vector copy number also were very important. Here you can see that sodium, lower sodium was actually associated with less likelihood of achieving CR, and higher calcium was also associated with less likelihood. Now, looking at baseline tumor characteristics, again, serum BCMA elevated, that is correlated with less likelihood of achieving CR, stringent CR. Similarly, elevated beta-2 microglobulin, and again, IgG heavy chain disease. Why is this? Probably because it's hard to clear that heavy chain disease component after CAR T. We see that, a lot of delays there. So even a smidgen of positivity on the immunofixation or 0.1 would have the patients be not in CR by IMWG. So that might explain it as well. Other issues of clinical laboratory measurements include D-dimer, ferritin, and sodium. This was also looked at. So elevated D-dimer and elevated ferritin ended up being something that was negatively associated with achieving CR, whereas lower sodium was also negatively associated with achieving CR. So we now know that there are ways that we can predict how people are going to do. And in this sub-analysis, patients with IgG heavy chain disease, elevated serum BCMA, elevated PT-INR, potentially elevated beta-2, elevated calcium, decrease in sodium, those patients all seem to have a less likelihood of achieving CR, and patients with higher vector copy number in the drug product actually have a better chance of achieving CR, which suggests that patients with higher disease burden do less well. And that helps us to understand what might be the ideal patients to bring to ide-cel CAR T therapy. And we know that there's another component, which is the drug product and the vector copy number, which may be a sign of T-cell fitness. We look forward to having this understood better as time goes on, so we can really try to make more sense of the data and really try to give CAR T-cell therapy to the patients for whom it's the most appropriate.